Hi, I am Justice Mashburn, and I am in Social Work Practice 1. And this semester, we had to complete 50 hours of volunteer service, and I picked the Refugee Empowerment Program in Memphis, Tennessee. I picked this program to volunteer with out of so many others because immigration transition is such an important part of social work. Social work is such a broad major. You can help, children. You can help people with disabilities. You can help the elderly. I mean, it goes on and on and on. And immigration is also in there. It's also a part of it. So I thought this would be a great experience, especially firsthand and hands-on with it to have under my belt, and to see what people really go through, not only to help them transition, but to also hear their stories about what they went through is also very, very important. The life of a refugee, I learned a lot about it. They have struggles with everything since the very beginning. As soon as they start, even before they start the transition, before they even get here, most refugees have the most basic aspects of life stolen from them. I mean, some of them were born in refugee camps where they live in different countries, and they want to pretty much just come here for a better life, and there is a transition into that, and a lot of it has to do with schooling, which is what I was kind of a part of when I volunteered there. It was mostly with the children of all ages from about kindergarten age to about 8th grade, and what I would do is I would help pick vocabulary words and books and different things in learning English aspect to them, and I would assign certain words and books and things to them based on their age, their grade, and their different reading levels that they had achieved in that time. But sadly, we had COVID-19 hit us pretty hard in the United States right when I had started beginning here at the Refugee Empowerment Program. So I didn't get many hours under my belt with that, but I'm very grateful for the experience that I did get to have, briefly with them. So next, we were offered to take certification courses outside of our volunteer hours, when we weren't able to attend anymore due to the virus. So I was able to complete 3 separate certifications. And with all of these certifications, they are very, very meaningful with social work. And the first one that I was certified in is increasing the effectiveness of suicide prevention. And this one, in my line of social work that I'm wanting to go into, this certification is definitely extremely important. And some of the main points in the certification course were you could integrate and coordinate suicide prevention activities across multiple sectors and settings. You implement research-informed communication efforts designed to prevent suicide by changing knowledge, attitudes, and behaviors. You increase knowledge of the factors that offer protection from suicidal behaviors and that promote wellness and recovery. Promote responsible media reporting of suicide, accurate portrayals of suicide and mental illnesses in the entertainment industry, and the safety of online content related to suicide. And that one is very, very important, especially to people around my age. Everyone is looking to be the next big thing on, TikTok or on Instagram. If you have these Instagram models, and, especially women, we look at these things and we are perceptive to be that way with them, and it's a whole altered reality that social media has given people, and I think that one is very, very important, especially in our day and time. Next, we Develop, implement, and monitor effective programs that promote wellness and prevent suicide and related behaviors. We also promote efforts to reduce access to lethal means of suicide among individuals with identified suicide risk. This is definitely important when it comes to intaking, your suicide patients, and figuring out in counseling that they are definitely on that track, and you want to keep, all of those means of medication and, different things away. Next is provide training to community and clinical service providers on the prevention of suicide and related behaviors. Next is promote suicide prevention as a core component of healthcare services. That's also very, very important. As far as healthcare services go, when someone says they're going to the doctor, the first thing that pops in your mind is, them being sick, as in, a cold or a sore throat or thing of that nature. But, a lot of people don't realize how mentally sick people actually are and can be, and they don't take it as seriously as it should be. Next is to promote and implement effective clinical and professional practices for assessing and treating those identified as being at risk for suicide behaviors. Next is provide care and support to individuals affected by suicide deaths and attempts to promote healing and implement community strategies to help prevent further suicides. This is also very, very important because, when we think of suicide awareness, we think of people who are suicidal, and we forget about the people who have been affected by suicide. Someone could never have been suicidal before, and they, as far as depression and anxiety and different disorders go, they had never experienced feelings like that before until they are affected by someone who has committed suicide. And all of these overwhelming feelings affect them as well. So we also need to definitely remember them. Next, we have increase the timeliness and usefulness of national surveillance systems relevant to suicide prevention and improve the ability to collect, analyze, and use this information for action. We have two more. Next is promote and support research on suicide prevention. This is also very, very important. And our last one is evaluate the impact and effectiveness of suicide prevention interventions and systems, and synthesize and, try to find these findings. My second certificate that I received was resilience factors for people who use drugs. There are 4 main objectives that were in this course, and the first one was that we discussed which acts can, make the victim blaming start, when they're trying to strengthen their resilience. And the second is investigate the key external factor for resilience found across all 3 levels of external protective factors. 3 is examine which protective factors feature both internal and external domains. And our last one, the 4th one, was describe the categories of adversity and identify where drug use falls. And those were the main objectives for that certificate that I had received. The last one that I received during this time was understanding co-occurring mental illness and substance abuse disorders. We're just going to speak briefly about this one, and we're not going to name the objectives because this one was one of the longest ones I did. There are in excess of 9 million people in our United States right now managing with co-occurring disorders. This double conclusion incorporates both the nearness of an addiction and emotional wellness issue or issues, including depression, anxiety, bipolar, PTSD, and it goes on and on and on. Co-occurring conditions can prompt a pattern of destruction and incorporates self-medicating when it's completely unnecessary. People with depression and PTSD and things, they go for, instead of their, antidepressants and things like that. They will go out and buy, 10 Xanaxes. They just want to feel numb and all of these other things, and they make themselves addicted to maybe these things that they may possibly need, but they will overcompensate all of that, and it turns into a drug use problem affecting their mental illness more than they think it actually is. This just exuberates everything with it, your psychological instability and then the fixation on top of it. So due to COVID-19, I was able to receive all 3 of those certifications, and those will definitely help me in my line of social work, and I'm truly grateful for being able to take those as well. And that is my 2020 volunteer experience. Thank you.